The most important issue in healthcare reform, I think, is to control the out-of-control costs of healthcare right now, and particularly of health insurance. I would argue that our health insurance in America today are not our friends because they're in a structure where they don't have to compete to make you and I happy. Quite frankly, you and I can't buy health insurance because the tax code makes only employer-provided health care tax-free. So you and I, as a practical matter, can't go out and buy it. For that reason, the health insurance industry, Cigna or United Healthcare, they don't advertise to try to get our business like the auto insurance industry does or like every other company in America. They just take us for granted because once they've sold our employer, we're stuck with their plan. And we really are stuck. We can't change it. We can't fire it. We need to reform healthcare so that it's personal, it's patient-centered, so that you and I can buy healthcare tax-free just like our employer could. That way, if we like our employer's plan, we take it and keep it. If we don't like the plan our employer offered us, then we go buy our own plan, but we buy it tax-free just like our employer can. That puts you and I back in charge. We become the boss. We can pick a plan that meets our family's needs. If that plan responds well, we keep it. If that plan doesn't respond well, we can fire it. So making healthcare personal and giving you and I the power to force the health insurance industry to compete for our business and keep us happy is the single most important aspect of healthcare. It's not having a government-run program. The government won't hold down costs. You and I both know that. But you and I can force the health insurance industry to compete, just like other people do, just like, for example, the auto insurance industry does. They compete for our business by telling us they'll give us better quality at a lower price. We need to bring those same principles to health insurance by enabling you and I to buy health insurance on our own. Americans are concerned about healthcare access, the quality of healthcare, and cost control. And we can achieve all of those. The critical things to watch are how do we do that? Some in Washington say the answer is that government involvement will solve those problems. I would suggest it's the opposite. The government has created a structure where access is restricted to those who are, quite frankly, wealthy. It's because the government has made it to where employer-provided care is tax-free, but if you and I are unlucky enough to have an employer that doesn't provide us care, we have to buy our health care with after-tax dollars. That makes it at least 1/3 more expensive. What we ought to watch is, does the health care reform empower you and I to buy the product we want? Republicans agree that no one with a pre-existing condition should suffer. They ought to be able to buy a policy at the same cost as the healthy, or roughly the same cost. They ought to be guaranteed the right to get that. And if they have MS and their costs are higher, we ought to share in that cost. Republicans also agree that we ought to cover every American. We already do under a law called EMTALA, which says that people can go into an emergency room and get free care, but that's not a very good venue. What Republicans think is that we should give them a voucher, essentially cash, to go buy a policy of their own. Those are the things to watch. Is it a top-down, government-controlled solution, or is it a solution that empowers you and I as patients, including giving money to those who need financial assistance to buy care so every American is covered? Americans are a very generous people. We care about our friends and neighbors. We lend a hand and help them whenever we can. For that reason, the whole discussion of whether healthcare is a right or a privilege, I think, just confuses the issue. The reality is, we as a society, we as people, made a decision many years ago that nobody in this country should go without basic healthcare. Each day in America, you don't see people crawling down the street because they have tuberculosis or they have a broken leg and can't get it set. That's because we as Americans already believe that we should care for those who are the least among us and who perhaps cannot afford to buy their own care. So right or privilege, it's really kind of not the point. We've already agreed. Everyone in America deserves basic health care. And that's why today in America, nobody goes without basic care, but too many people go without what we would call coverage, which means choice in care. They can go to an emergency room, but lots of times they don't want to do that. They don't want to be a burden on society, so they don't go in for the kind of preventive care that they probably should. The Republican plans, my bill, the Improving Health Care for All Americans Act, says every single American, the wealthy and the least among us who can't afford it, should have resources, including help financially from the government, a voucher, to go buy a health care plan that at least meets their basic needs. That puts the issue of right or privilege behind them. And we cover every American. As a matter of fact, in my bill, we say if you can buy your own health insurance, take a tax credit and buy it, and don't send that government money to the government. But if you can't buy a plan, we'll give you a stipend. But I go beyond that. I say that if you don't respond to the communication from the government that gives you free health care or a stipend to go buy your own, we'll put you in a plan so that when you do show up and need care, let's say you just missed the mailing saying you could buy a plan, or you're a homeless person. When you do show up for care, they look you up in a database, they find your Social Security number and your name, and the government has already set aside enough money to cover you. That is what America has already decided. No one in our nation should go without care. But that doesn't require compulsion or a government mandate or a government takeover. It just requires that we embody in our law the things that we've decided as a society. Everyone should get a basic level of care.